You touched on a lot of kind of what I was getting to. I'm excited to know that you all are being mobile and that you're going and meeting farmers where they're at physically, because that can make a huge difference. The only other follow-up question that I had that I'm not really sure who this pertains to, because it was when the gentlemen were presenting, was that you had talked about a partnership with Mental Health of America and the fact that you'd raised $8,000. So curious about what those funds, what the intentions are for those to be used for. Is it to support the work that's currently being done, or is it earmarked specifically for one thing?
We haven't decided. We just received it yesterday.
Congratulations.
So I mentioned that we're putting together an advisory council. The usage of all funds will be decided by that advisory council.
Okay.
But I will add that I've already gotten an email or text about people want to donate to us, and since yesterday I've received that text about donation.
That's wonderful. Well, what I heard you say, which really gets back to the initial question when the gentlemen were presenting, is what is it that we can do to help support your efforts? And what I heard you say is that we have more people asking for help from us than what you either have the capacity, the people power, and typically funds are tied with that, right? We like to pay people to do the work, particularly compassionate work such as this. So if there is an ask in the future, I would really love to hear what we could do as a General Assembly to support this work, whether that's deploying more mobile units, helping you all increase your staff, figuring out how do we scale up what it is you're doing, because the work is so critical.
Yeah, with again, manpower and capacity, both administrative and the boots on the ground folks. And I will say, something to put I'm tired of putting my stuff in the basement, but it would be nice if we had something that we could just pull in, have our stuff, open it up, just like we did yesterday. And I will say that, especially in the summertime, there's a lot of nursing students to work. And so I have nurses coming to me all the time and calling to say, we want to help. We want to help. And if I could there's only one of me, and there's one Susan Jones in Western Kentucky. And I'm sure we would have nurses that we could pay, or they would volunteer, and an administrative person to help keep up with all of this and to teach safety and to go out in our schools, again, to just have more people that can be out and about across the state.